Florida retirement. You've heard the pitch 1,000 times. Sunshine, no state income tax, early bird specials. Cool. But nobody tells you the part where a decent house near Tampa costs $500,000, or that coastal hurricane insurance runs $600 a month, or that the nearest specialist who can actually treat your condition is 2 hours away in traffic you can't believe exists in a state this flat. Here's what's actually happening. There are 20 towns in Florida where the math works completely differently. We're talking median home prices under 300 grand, some under 200, with major hospital systems 10 minutes down the road. Places where your property taxes drop by thousands annually because the county actually adopted the senior exemption. Towns positioned right off interstates so you're 45 minutes from Mayo Clinic or UF Health when you need the heavy hitters, but you're paying Heartland prices for your house. This isn't about finding some mythical perfect town. It's about understanding the trade-offs that actually matter. Distance versus dollars. Coastal access versus insurance reality. 20 towns. 4 distinct regional patterns. The actual numbers that determine whether Florida retirement is a financial win or a slow bleed. Here are 20 affordable Florida towns with excellent healthcare access. Sebring. Sebring sits in Highlands County with a cost of living index of 88. That's 12 points below the national average, which translates to fundamentally lower monthly expenses than most of America. Median home price? Between $190,000 and $210,000 right now. The healthcare setup is Advent Health Sebring, which specializes in geriatric medicine and rehab services, plus HCA Florida Highlands Hospital, both systems in the same small town. Violent crime rate here is 21 per 100,000 residents. National average is 22.7. The trade-off is geographic. Sebring is inland heartland. Orlando's elite medical facilities? Hour and a half. Mayo Clinic in Jacksonville? 2 hours minimum. If you've got complex chronic conditions requiring frequent specialist visits, that distance becomes a weekly tax. But if your health is stable and you need solid primary care, geriatrics, and emergency services, Sebring delivers all of it while your housing costs stay in the realm of actual human comprehension. Bartow. Bartow is in Polk County, south of Lakeland. The cost of living here runs 6% less expensive than the average Florida city. Median home prices sit between $260,000 and $290,000. Healthcare costs specifically are rated less expensive than the national average. Local acute care comes from Bartow Regional Medical Center. And here's the positioning advantage. You're 30 to 45 minutes from Lakeland Regional Health and roughly the same distance to the Tampa-Orlando Medical Corridor. You get deep affordability on daily expenses without being marooned. Specialist access exists, it just requires planning. Ocala. Ocala is the Heartland's major hub. Cost of living index of 87. Median home prices between $240,000 and $260,000. But the real story is the healthcare density. You've got HCA Florida Ocala Hospital, which made America's Best Hospitals list for 2024. Then Advent Health Ocala, then Marion Community Hospital. 3 major facilities competing for patients in a mid-sized city. Competition drives quality. When hospitals have to fight for patient volume, service standards go up. Wait times drop. It's basic market mechanics applied to healthcare. Then there's the infrastructure nobody talks about until they need it. SunTran Paratransit, door-to-door service for transportation disadvantaged seniors. You stop driving, you don't stop accessing healthcare. That system exists in Ocala because the retiree population is dense enough to justify the funding. In lower density towns, that service just doesn't materialize. Ocala is the rare affordable town where you get metropolitan level medical options without metropolitan cost of living punishment. The COLI is 87. Tampa's is 104. That 17-point gap is hundreds of dollars monthly across groceries, utilities, dining, services. Zephyrhills. Zephyrhills runs a cost of living index of 87.8, essentially identical to Ocala, but it's structured completely differently. This is active adult community territory, the villages of Zephyrhills, golf courses, amenity centers, the whole engineered lifestyle package. You're 45 minutes from Ocala's hospital cluster and right near HCA Florida Citrus Hospital. So you get the 55+ community amenities without paying Villages core pricing, and you maintain access to serious medical infrastructure. The Villages itself has a COLI of 97.9. Citrus Hills delivers the same basic package at 87.8. Lake City. Lake City sits at the intersection of Interstate 10 and Interstate 75 in Columbia County. Median home prices between $260,000 and $290,000. The actual value proposition is the interstate access. You're 45 to 60 minutes from UF Health Shands Hospital in Gainesville, which is nationally ranked in neurology, urology, and diabetes and endocrinology. Not pretty good for Florida. Nationally ranked. You're also an hour-ish from Jacksonville's Mayo Clinic, which holds national rankings in 5 specialties. So Lake City becomes this weird strategic node where you pay small-town housing prices, but you're positioned on major highways that plug you directly into Florida's most advanced medical centers. This matters intensely if your health profile is complicated. The difference between solid local hospital and nationally ranked specialty center is the difference between maintenance and optimal treatment. Inverness. Inverness is in Citrus County, west of Ocala. It falls into the lowest 15% of Florida's cost of living scores. Local acute care is HCA Florida Citrus Hospital. You're also positioned for relatively quick access to Ocala's hospital cluster to the east and the Tampa Bay Medical Corridor to the south. The appeal is simplicity. You're not paying coastal premiums. You're not in a massive planned community with HOA fees. You're in a straightforward, affordable Florida town with reliable local healthcare and options in multiple directions when you need specialists. Zephyrhills. Zephyrhills is the northern edge of the Tampa metro area, and the housing discount is absurd. Median home prices between $191,000 and $250,000. Florida's state median sale price is $412,000. You're looking at a $200,000 spread for proximity to the same labor market and medical network. Advent Health Wesley Chapel is 30 minutes away. The broader HCA Florida healthcare network across Tampa is all within 45 minutes. You're plugged into a major metropolitan medical ecosystem without incurring the Tampa Core Cost of Living Index of 104. This is pure metropolitan fringe arbitrage. You trade a half-hour commute for massive housing savings, and since you're retired, that commute isn't daily. It's when you have a specialist appointment. The rest of the time, you're living in a town where your home cost half what it would 20 miles south. Pensacola. Pensacola is the Panhandle's major city, and it maintains a COLI around 93, higher than the Heartland, but still below the national average and way below South Florida. Median home prices between $260,000 and $280,000. The healthcare anchor is Ascension Sacred Heart and the HCA Florida Healthcare Network presence in the region. Multiple facilities, full acute care, specialists on staff. Pensacola functions as a regional medical hub, so you're not just accessing a single hospital, you're accessing a system with depth. For a metropolitan area, Pensacola is an actual city, not a town. Keeping costs this low while maintaining robust medical infrastructure is legitimately unusual. Most Florida cities this size cost more to live in. Pensacola manages to stay affordable because it's the Panhandle, and the Panhandle doesn't carry the same demand pressure as Central or South Florida. The climate's similar, the beaches are arguably better, the housing just costs less. Brooksville. Brooksville is in Hernando County, positioned for easy access to Tampa's medical corridor. The town itself is firmly in the retirement on a budget category. Small-town housing affordability with none of the sprawl or congestion you'd associate with being this close to a major metro. You're a quick drive to HCA Florida Northside Hospital, HCA Florida Largo Hospital, and the rest of Tampa's extensive provider network. The commute is real but manageable, and the housing savings are immediate and permanent. The logic is identical to Zephyrhills, metropolitan fringe arbitrage, but Brooksville skews even quieter and more rural feeling. If you want actual small-town atmosphere without sacrificing access to big city medicine, Brooksville executes that balance cleanly. Lakeland. Lakeland is in Polk County with average rent around $1,314 monthly. It features a strong local system, Lakeland Regional Health, providing comprehensive care without needing to leave town for most issues. But Lakeland's unique positioning is that it's almost exactly between Tampa and Orlando, equidistant. So when you do need specialized care, a specific surgeon, a particular subspecialty clinic, a clinical trial, you have two major metropolitan medical ecosystems to choose from. That optionality is rare. Most towns plug into one system. Lakeland plugs into two. It's a fail-safe. If Tampa's wait times are long or a specialist isn't available, you pivot to Orlando. If Orlando's booked, you go Tampa. The competition for your healthcare business works in your favor, and the housing costs stay well below what you'd pay in either metro core. Deltona. Deltona is in Volusia County, Central East Corridor. Median home prices around $305,000, which is higher than the Heartland but still substantially below state averages. Healthcare access leverages proximity to Daytona and the Sanford-Orlando corridor, including Advent Health Fish Memorial. Daytona Beach itself has a COLI of 94.9 and hosts major providers like Halifax Health and Advent Health Daytona Beach. So Deltona functions as a slightly cheaper access point to the same regional medical network. The positioning also puts you near the coast without the full coastal insurance penalty, though you're still close enough that hurricane risk is real and premiums reflect that. It's a middle ground play. Some coastal access, moderate affordability, solid healthcare proximity. Melbourne. Melbourne holds a COLI of 95.6, which makes it one of the best value propositions on Florida's Central East Coast. Coastal Florida is expensive. Melbourne is measurably less expensive while maintaining immediate access to Holmes Regional Medical Center and surrounding Advent Health facilities. You get the coast. You get local acute care. You get a cost structure that doesn't destroy a fixed income. The trade-off, same as any coastal town, is hurricane insurance. That $300 to $600 monthly premium variance versus inland towns is a real cost that compounds over time. But if coastal access is non-negotiable, if being near the beach is a core quality of life factor, Melbourne is one of the few places where the math doesn't completely fall apart. North Fort Myers. North Fort Myers is the discount entry point into Southwest Florida. Median home prices consistently below $400,000, which in Lee County context is a genuine bargain. You're accessing the Lee Health System, the largest public health system in Southwest Florida, plus numerous HCA facilities serving Fort Myers and Cape Coral. Here's the critical detail. Specific municipalities within Lee County, Cape Coral, Fort Myers Beach, Village of Estero, have adopted the maximum additional $50,000 senior homestead exemption. That exemption is a local option. If your town adopted it, your property taxes drop significantly. If they didn't, they don't. For a region where the overall cost of living runs higher, that local property tax relief is the mechanism that makes retirement financially viable. It's a deliberate policy choice to attract and retain fixed-income seniors, and it works. But you have to verify adoption before you buy. Two identical houses, adjacent towns, $3,000 annual difference in property taxes based solely on local government ordinance. Lehigh Acres. Lehigh Acres is inland from Fort Myers with extreme rental affordability. Average rent of $741 monthly. That's outlier level cheap even for inland Florida. You're 30 minutes from the Lee Health System in Fort Myers. Housing costs are a fraction of the coast. You're giving up immediate proximity and coastal lifestyle, but you're gaining massive monthly cash flow retention. For retirees on the tightest budgets, Lehigh Acres is one of the few places where rent stays genuinely low, while healthcare access remains within reasonable distance. Edgewater. Edgewater is in Volusia County on the affordable section of the Central East Coast. Home prices generally around $300,000. You're about 30 minutes from Daytona Beach medical facilities, Halifax Health, Advent Health New Smyrna, another coastal value spot. You get beach proximity without full coastal pricing, though insurance premiums will be higher than inland alternatives. The medical access is strong, leveraging Daytona's infrastructure. The Villages Periphery. The Villages itself has a COLI of 97.9. The move is to focus on peripheral towns like Lady Lake or Leesburg. You access the medical facilities serving the mega community, Villages Regional Hospital, UF Health Leesburg Hospital, Advent Health Waterman, without paying for a home inside the core 55-plus development. The infrastructure exists because the Villages created the demand. You just position yourself on the edge and benefit from proximity without the premium. Alachua. Alachua is a small town near Gainesville. Housing costs run slightly higher. Gainesville proper has median home prices around $280,000 to $300,000, but you're 15 to 25 minutes from UF Health Shands Hospital. UF Health Shands is nationally ranked in neurology, urology, diabetes, and endocrinology, academic medicine, teaching hospital, clinical trials. If your health situation is complex and evolving, that proximity is worth the housing premium. High Springs. High Springs is another Gainesville satellite, following the same model as Alachua. Quieter, lower density, slightly cheaper housing than Gainesville proper. Quick drive to UF Health Shands. You're not maximizing daily affordability. You're prioritizing medical proximity for complex care. If you're managing multiple chronic conditions, being 20 minutes from a nationally ranked academic center is the single most valuable geographic decision you can make. Soto City. Soto City sits near Sebring with the same extremely low COLI of around 88 while remaining within short drives of Advent Health Sebring and HCA Florida Highlands Hospital. This is the quietest, most rural-feeling option. Maximum financial savings, solid local health care. Trade-off is distance to any major metro or specialized facility. But if your priority is stretching every dollar and you don't anticipate needing frequent complex care, this executes that mission perfectly. Lorida. Lorida follows the same pattern as DeSoto City, leveraging Sebring's low COLI and healthcare access while offering an even quieter, more rural setting. You're still within range of both major Sebring hospitals. Same logic. Maximum affordability, reliable local care, longer drives for tertiary services. The model works if your health is stable and your priority is cost minimization. The pattern across all 20 towns is that Florida retirement affordability isn't about a single factor. It's the compound effect of zero state income tax, local property tax exemptions that vary by county ordinance, geographic positioning relative to healthcare networks, and insurance costs tied to climate risk. The deepest affordability, COLI 87 to 88, concentrates in the heartland. Ocala, Sebring, Zephyrhills. Maximum daily expense reduction, solid local care, longer drives for specialized medicine. The northern gateway towns trade a slight cost increase for strategic interstate access to academic medicine. The metropolitan fringe plays deliver big city medical networks at suburban prices through deliberate distance arbitrage. The coastal options add lifestyle factors at moderate premiums with insurance reality baked in. No perfect town exists. Every choice involves trade-offs. Distance versus dollars, coastal access versus insurance costs, local sufficiency versus specialist proximity. The goal is matching your health profile and financial constraints to the regional pattern that serves them best, and verifying the details that actually move the numbers, whether your county adopted the senior exemption, whether paratransit exists for non-drivers, what the actual hospital quality ratings are, what insurance will cost at your specific address. The 20 towns are the proof that the math can work. The question is which trade-offs you're willing to make and which benefits you actually need.